Good morning. My name is Kanyesa. I'm the clerk at Tygerberg Hospital at Cancer Unit. I have spent much time with patients just like you, and I would like to take you on a journey through the Cancer Unit to teach you more about the treatment you are going to have.
This video is an information video on chemotherapy and is shown to you in your own language to make sure that you understand your treatment really well. This treatment is offered at many other hospitals in the country and the world, and some patients from different hospitals might be watching this video. Everyone is welcome on this journey, and we hope that many of your friends and loved ones may also see this video, because it is good when you don't have to go on this journey on your own. We treat many people with many different types of cancers at this hospital. Some people may have cancer in their breast, others may have cancer in their lungs, or another part of the body, or more than one part. It is important to understand that every type of cancer is different, and every type of cancer needs its own treatment with its own side effects. Many people will tell you about experiences they have had in their own lives or with people they were close to. Sometimes these stories are good and make you feel strong, but sometimes these stories are not nice to hear and they may scare you. It is important to remember that everyone's cancer is different, and the only person who can tell you the facts about your disease is your doctor. Your doctor will tell you about your own type of cancer and what the treatment involves, and can answer whatever questions you have. If you do not understand English or Afrikaans, it can help to bring a family member or friend who can speak English or Afrikaans when you visit the doctor. If you cannot find anyone to come with you, please tell the doctor so that a translator may be called to help you during your doctor's visit. Today you will receive a letter from your doctor that says what type of cancer you have and how serious the cancer is. This letter is very important. Please show it to your day hospital or local clinic so that the workers at the clinic will know what is wrong with you and whom to call if you need help. Cancer is not a new disease. It has been around for thousands of years. Not only people, but also animals and even plants can get cancer. Cancer is not a disease of poor or dirty people. It affects all people regardless of their race or financial status or beliefs. We know that cancer tends to affect older people, but younger people and even children can develop cancer. We develop cancer when a certain part of the body develops a lump that grows like a weed. It starts small, but if it is not pulled out by the roots, it can grow strong and big like a tree and even spread to different parts of the body. It is much easier to cure a small cancer than it is to cure a cancer that has spread to other parts of the body. This is why it is important to start treatment as soon as possible. Cancer can return to the body years after the treatment is over. And that is why it is important to come back for your checkups, as is written on your appointment card. It is always easier to cure a cancer that has come back when it is small, before the roots are deep and it spreads around the body. Some people may say that cancer can be caused when an enemy curses you, or that cancer is a punishment for sins.
We are working hard to know what is the causes of the cancer, but we don't believe that is the punishment for your sins.
The treatment you will receive here is very powerful, and if you receive all of it, especially if you get it before the cancer has spread too far, it will help you, regardless of what caused the cancer.
We use several methods to treat cancer.
Many patients have surgery to cut out as much of the cancer as possible. If that is not enough, other methods are used. The two most common ones are chemotherapy and radiotherapy. Chemotherapy is treatment with special medicine that is very strong. Sometimes we use chemotherapy before surgery to shrink the cancer so that it will be smaller when we cut it out. Most often, we use it after surgery to kill any possibly remaining cancer. Sometimes when cancer has spread to different parts of the body, we use chemotherapy to help people feel healthy and strong for as long as possible. We use needles to drip the liquid medicine into the body. It may look like the liquid drips that you may have received at the day hospital if your body needed extra water, but what is in the drip is very different. Many different kinds of liquid medicine are used in chemotherapy. Some are red, others blue, and still others colorless like water. Your doctor will choose your treatment depending on where in your body the cancer is, how serious it is, how old you are, or what other diseases or other conditions you have. Don't worry if you don't have the same treatment as someone else you know who has had cancer, or if your treatment affects you in a different way. If you receive chemotherapy, you will have to come to the hospital for several hours every few weeks for several months.
I will explain the chemotherapy visit, and also I'm going to take you around to the cancer unit.
When you arrive, we take a blood sample and send it to the laboratory to make sure that your body is strong and ready for your treatment. We usually have to wait an hour or two for the results. The earlier we can send the sample to the laboratory, the earlier we can get the results and start the treatment. Meanwhile, the doctor will see you to find out how you are feeling. Please tell the doctor if you are feeling ill or if the treatment is making you feel unwell.
You are allowed to eat your breakfast before you come to the hospital.
If you usually take pills or other medicine for other conditions every day, you should take those medicines as you usually do. After the blood results are ready, you will go to the chemotherapy room. Here you will sit in a comfortable chair and a sister will put a needle into a vein in your arm. Some chemotherapy treatments take a few minutes. Others take many hours to run into your body. Your doctor will choose whatever medicine is best for you and most likely to defeat your disease. While you are getting the drip treatment, you may get a strange taste in your mouth. Some people say it tastes like metal, or you may start to feel unusually warm. A few people start to feel itchy or short of breath. If you feel anything unusual like that, you need to tell the sister so that she can help you. After the treatment is finished, the sister will remove the drip from your arm. You will receive medicine to take home with you, as well as a date to come back to the hospital for your next treatment. Treatments are usually given every 3 or 4 weeks, and most people need between 4 and 6 treatments. This means that your chemotherapy will last more or less 4 to 6 months in total. You do not have to stay in the hospital between the treatments, and you can continue your normal life at home as soon as you feel ready to do so. It is very important that you keep all your appointments and receive all the treatments that have been planned for you. If you miss treatments, the cancer can come back stronger than before. If you need to miss an appointment, you must call the hospital to reschedule it as soon as possible. The treatment that is chosen for you will be one that has been successful in the past at killing the kind of cancer that you have. But almost all treatments that are strong enough to kill cancer can also harm normal parts of the body. Most kinds of chemotherapy cause people to lose all their hair. But after the treatment ends, the hair grows back. You can wash your head and touch it without feeling afraid. It may be a little sensitive at first, especially to cold, but you can keep your head warm with a scarf or a warm cap.
It is safe to wear a wig if you want so.
Many women develop a darker discoloration of their nails. This is something that we often see with chemotherapy, and the nails will grow out to be normal after the treatment is over. Some people may notice that the chemotherapy may cause the veins of the arms to become darker, just like a road map. This is something we see often too, and it will get better once the treatment is over, but it is unfortunately not something that goes away completely. One of the most important side effects of the treatment is nausea, but we add to the chemotherapy liquid other medicine that prevents nausea. As a result, most patients can travel home after chemotherapy without feeling ill. The medicine that you take home also includes tablets to prevent nausea. You need to take the first one right after you finish your treatment, on the same day. We normally say to take your first tablet in the afternoon and your second tablet in the evening before you go to bed.
You don't need to eat before you take the tablets, but it is important for you to take your tablets even if you don't feel nausea.
You need to take the tablets again first thing the next morning and then before every meal. If you take the tablets correctly and are still nauseated, or if you have been vomiting, you may use the suppositories in your take-home package. It is good if you keep the suppositories in the fridge or a shady area, because if they get warm, they will melt. To use a suppository, remove it from its wrapper and carefully insert it in the anal canal. You can use up to 3 suppositories, one at a time, a day. While you are receiving chemotherapy, it is important to drink at least 2 liters of fluid every day. Drinking water prevents the kidneys from getting hurt and keeps the body strong to fight the cancer. It is usually good not to eat too much oily, fatty, or spicy food, like curry, during the first few days after each treatment. We can recommend plain food without too much spice, for example, mashed potatoes or boiled vegetables. Peanut butter is a good source of protein, and you can mix a few spoons of peanut butter in milk to make a milkshake. After the first few days, you may eat anything you want. You do not have to buy expensive food or expensive vitamin tablets during chemotherapy. The chemotherapy may cause acid reflux, and for this, you can use acid tablets or acid gel. If you do not have these at home, please ask your doctor at your next visit, or you can visit your nearest clinic. Some people may experience diarrhea during the first few days after chemotherapy. If you have diarrhea, you should drink a lot of fluid to make sure that the body does not become dry. You can visit your day hospital to ask for little tablets that we use to stop diarrhea, or buy them from the pharmacy. You should take 1 tablet every time the tummy is running until it becomes normal again. If you have diarrhea more than 3 times a day, you need to see the doctor at the clinic for further treatment.
Other people develop constipation.
It is important to include fruit and vegetables in your diet if you have access to fresh produce. You can also ask for something to loosen your stomach at your day hospital. This is usually syrup or little brown tablets that are taken at night. Drinking enough water is also important to keep the tummy soft. Most of these side effects are not dangerous and go away when the treatment is finished.
Chemotherapy has more serious side effects. Those side effects I will explain to you now.
Chemotherapy is harmful to unborn babies, and it is important to make sure that you do not fall pregnant during chemotherapy or for at least a year after your treatment completes. There are many ways to prevent falling pregnant, and it is important to choose a method that works for you and your partner. The chemotherapy may harm any baby that is breastfeeding, so it is important that you don't expose any baby to your breast milk for at least 6 months after the treatment completes. Chemotherapy may also impact your ability to have children in the future, and it may bring the change of life at an earlier age. It is very important to talk to your doctor today if you plan on having another child. Chemotherapy kills the cancer cells in your body, but sometimes it may also hurt some of the good cells in your body that protect you from getting sick. These cells are called soldier cells, and they are important to keep you healthy and fight off any infection. Sometimes the chemotherapy can injure the soldier cells and make the body weak in fighting sickness. The soldier cells usually recover by themselves after chemotherapy, but it is important to go to the nearest hospital with your referral letter if you develop any fever, even if it is after hours, especially if you also have burning urine, a cough, or a sore throat. Remember to take your letter with you and to tell the doctor that you are a cancer patient that is receiving chemotherapy. You are allowed to call an ambulance if you are sick and do not have transport to get to your nearest hospital. If you go to the hospital quickly, we can give you antibiotics and you will recover quickly. But if you wait, you may develop a very bad infection. Please tell the doctor if you are having pain. Pain has no benefits. Pain can spoil your appetite and make you depressed or angry. We can give you good tablets or a pain syrup to keep you comfortable. If you are having pain regularly, it is very important to take the pain tablets regularly and not only if the pain is really bad. Please tell your doctor if you have any other diseases, including high blood pressure, sugar disease, TB, and even HIV. Remember to tell your doctor if you have ever had a heart attack or stroke or another cancer or a big operation. Please tell your doctor about any other medications or treatments you are receiving, including traditional medicine or the services of a sangoma. When other medicines are given with chemotherapy, the combination may make you sick. We may ask you for your sangoma's contact information or the contact information of any other doctor you may be seeing. Please tell your doctor if you have plans to travel away from home during your treatment. If you feel well, you may travel, but your travel must not prevent you from receiving the correct number of treatments and at the right time. Please tell your doctor if you have ever had a bad reaction to medicine before.
We don't want you to have a bad reaction to the medicine again.
We have a social worker in the hospital, and she can meet with you to discuss your home circumstances. Sometimes patients may have lots of family members that are able to help them during their treatment, while some patients may be far away from home without much support. We would like to know your circumstances so that we can help you make the best plan for support in this difficult time. The social worker can also tell you about places in your area that offer support to patients with cancer. Depending on your needs and what is available in your area, the social worker can connect you to hospice facilities or home-based care that is provided by volunteers or other organizations such as cancer. Your church may also provide some supportive services.
You are not alone, and you don't have to feel alone in this journey.
You are welcome to ask the doctor whether you qualify for a disability grant. The government controls the disability grants in South Africa and tells doctors which patients can get disability and which patients cannot. If you qualify, the doctor will ask you to see the social worker to fill out the grant form, and the doctor will sign the form. We need your green identity document to fill out these forms, so it's good to bring it with you just in case. The social worker can also help you if you are employed. Your treatment will probably require you to take time off from work or to change your hours, at least for a while.
Remember that you cannot be fired because you have cancer.
If you wish to keep your cancer a secret at work, that is your decision. We will never talk to anyone without asking your permission first.
But we do need to talk about it in general.
It is best if we can make sure that your boss understands what is wrong with you and what your treatment is about. We are here to help you and we want you to get well. In order to get well, you need to come here for visits that will take several hours, every few weeks for 4 to 6 months. You will need to keep all those appointments. You may have side effects such as nausea or vomiting or diarrhea. Most people will lose some or all of their hair, but it grows back. Your nails and veins may discolor. If after you leave the hospital and go home, you feel that something in your body is going wrong, please take your referral letter to your nearest day hospital or call the cancer unit for advice. Do not come to the cancer unit without an appointment.
We do not offer a walk-in services in our hospital.
We can see patients only if they have phoned the cancer unit and have been told to come in. It is safe to attend your local clinic with problems, and the doctor at the local clinic or hospital will call our unit if they are not able to help you. You are allowed to call an ambulance if you are sick and you don't have access to transport. The ambulance will take you to your nearest clinic or local hospital. The good news is that we can help you, and if you work with us, we can minimize many of those side effects.
If you have any questions, you can call us anytime.
I hope that your journey with us has been good today, and that you understand a little bit more about your treatment.
May you have a safe journey and may you be blessed.